So, symptoms are said to be subjective science or subjective measures of disease. Such as symptoms are subjective changes in body functioning. A good example of that is pain. So, we sometimes some microbial infections or infectious diseases are associated with pain. So, there's no way to quantitatively measure or describe pain. And we record pain according to the subjective judgment of the patient or the one experiencing it. And contrary to symptoms, we have signs, which are measurable changes in body functioning. Signs include temperature changes, or temperature rather, not change, not essentially temperature changes, but temperature itself. Heart rate, pulse rate, respiratory rate, those things that can be measured objectively and can be recorded. Signs and symptoms are used and when are used in the diagnostic process or in the identification process of what disease a person is experiencing, and when they're grouped together or when they are or associated with each other, we define the syndrome, no, of a certain microbial infection. Syndrome refers to specific group of signs or symptoms that will always accompany a specific disease. Now, let's further talk about diseases by defining how transmissible they are and how infectious they can be in terms of area or part where the infectious process actually happens. Two types of diseases we have according to transmission or transmissibility. We have communicable and non-communicable. Communicable diseases are diseases that are transmitted directly or indirectly from one host to another host. Could be human to human, animal to animal, or human to animal transmission. No. Special examples of communicable diseases that are easily spreading from one host to another are said to be contagious diseases. So, contrary to communicable and contagious diseases, we have non-communicable diseases. Non-communicable diseases are those that are caused by microbes that, when transferred to another host, may not really cause the same thing that it did in the original one, in the original host. So non-communicable diseases are normally produced by microbes found in the environment that are not usually normal microbiota. A good example of that are Clostridium tetani. All right. In terms of scope of infection, we have the following terms to be defined. A local infection is an infection that affects a small area or a small part of the body. In That's the direct opposite of systemic infections. Systemic infections are infections that happen in uh, greater or massive areas of the human body. They spread throughout the body. Could be by means of the blood, usually by means of the blood, since blood serves as the primary connective tissue that transports um, nutrients and other factors in different parts of the body from one body part to another. The presence of bacteria in the blood is recognized as a bacteremia, right? And when these bacteria, or when a bacterial species multiplies in the blood, we call the condition septicemia. So, aside from local and systemic infections, other microbial infections may also happen because of a primary event. So for that cases, we call the infection secondary. So secondary infections occur after a host experiences a primary infection. Okay? Good example of a secondary infection is, let's say, an enteric bacteria migrating extraintestinally because of a parasitic lesion. For the case of entamoeba, some entamoeba species like Entamoeba histolytica capable of forming